The integumentary system forms the external body covering and protects tissues from injury. It also synthesizes vitamin D and houses cutaneous receptors in sweat and oil glands. It also protects our internal organs from drying out. It protects against bacteria and sunlight. The muscular system allows manipulation of the environment, locomotion, and facial expression. It also maintains posture and produces heat. An example of how the muscular system works is the movement of food throughout our digestive system. The skeletal system protects and supports body organs and provides a framework that the muscles use in order to cause movement.
The nervous system is a main communication system of the body. It includes the brain, spinal cord, nerves, and sensory receptors. It's a fast-acting control system that responds to internal and external changes by activating appropriate glands and muscles. The endocrine system is the other main communication system of the body. It includes the pituitary gland, thyroid, parathyroid, and thymus, just to name a few of its components. It releases hormones so that they circulate in the body. It secretes hormones that regulate processes such as growth, reproduction, and nutrient use by body cells. The respiratory system includes the mouth, nose, and lungs, just to name a few of its components. It keeps blood constantly supplied with oxygen and removes carbon dioxide. It exchanges gases between the blood and air.
The cardiovascular system consists of the heart, lungs, arteries, veins, coronary, and portal vessels. This system is responsible for the flow of blood, nutrients, O2, and other gases. This system is also known as the circulatory system. The digestive system consists of the gastrointestinal tract, which also consists of accessory organs, which are the tongue, the salivary glands, the pancreas, the liver, and the gallbladder. This system breaks nutrients into small parts so the body can absorb it in order for it to be used for energy, growth, and cell repair. The urinary system consists of the kidneys, the ureters, the bladder, and the urethra. This system produces, stores, and eliminates urine, which is a fluid waste excreted by kidneys. The urinary system works with the lungs, skins, and intestines to maintain a balance of chemicals and H2O in the body.
The immune and lymphatic systems work together as an extensive drainage network that helps keep bodily fluid levels in balance and defend the body against infections. It is made up of a complex network of lymphoid organs, nodes, ducts, tissues, and lymph capillaries, and a network of lymphatic vessels that carry lymph and other substances throughout the body. There are three main functions of these systems: the removal of excess fluids from body tissues, absorption and transportation of fatty acids, and the production of immune cells such as lymphocytes, monocytes, and antibody-producing cells called plasma cells. The major function of the reproductive system is to ensure survival of the species. Within the context of producing offspring, the reproductive system has four functions: to produce egg and sperm cells, to transport and sustain these cells, to nurture the developing offspring, and to produce hormones. Moving on to pathology and pharmacology. Cervical cancer affects the female reproductive system. Cervical cancer forms when the cells that line the cervix begin to develop abnormal changes. Over time, these mutated cells may grow out of control and form a tumor. There are two main types of cervical cancer: squamous cell carcinoma, which accounts for 90% of all cases, and adenocarcinoma of the cervix. This type of cancer develops in gland cells. This is also somewhat rare, but has become more common in recent decades. Symptoms of cervical cancer include vaginal bleeding between periods or after intercourse, post-menopausal vaginal bleeding, vaginal discharge, and pain in the pelvis. In order to diagnose cervical cancer, these tests and tools are used: Pap test and pelvic exam, colposcopy, biopsy, imaging tests, and lab tests. In order to treat cervical cancer, gynecological oncologists work with cervical cancer patients to design a treatment plan tailored to their specific diagnosis and needs. Treatment options for cancer of the cervix include surgery, chemotherapy, radiation therapy, targeted therapy, and immunotherapy.